All right, go ahead.
Okay. Hi, my name is Andy Beto. I'm with PATH in Seattle, Washington. We're an international nonprofit NGO based in Seattle. We work in about 70 countries around the world, focused in global health. The project I'm going to talk about is affordable point-of-care specimen processing. The goal is to basically introduce flexibility into viral load testing for anti-retroviral management programs and third world programs. Currently, when people are on anti-retroviral programs, for instance like HIV, they're required to go through some viral load testing to monitor the drugs they're on to see if they're being effective, at reducing their viral symptoms. If they aren't, you want to be aware if they're producing drug-resistant strains of their drugs that they're on. So this is to basically kind of change some of the challenges that people are facing out there with viral load testing, and some of those would be time requirements when a patient comes in to give a sample of their blood to be tested. They need to have it to a central laboratory within 6 hours. So that can be a cost challenge and a logistical challenge for the health system that's doing that. The other thing is cost. The patient itself incurs quite a bit of cost to try and give that sample up. So we wanted to introduce flexibility for the health system to be able to do processing at point of care and then be able to stabilize that specimen and then send to a central lab at a later date versus immediately. So basically our project involved kind of two portions, a technical portion and kind of an economic analysis portion. The economic analysis was in Nicaragua, where they basically looked at all costs throughout the health system to evaluate where savings may be met and what appropriate prices may be for such a kit. Basically, the takeaways from that were is that the viral load test is a significant cost in the process, and that the patients basically bear a big brunt of that cost as well. The technology portion is basically being built off of low-cost laboratory disposables that are currently in use now. And we developed some interfaces to basically allow the kit to be built around these disposables to make it more modular, so you could design it for different types of pathogens or other diseases out there, such as dengue or malaria or HIV. And so it basically consists of a little small pipette that basically has a little connector that allows it to connect to a syringe. The syringe allows us to basically avoid using a centrifuge to be able to isolate the RNA, in this case, out in the field. And then basically there is a little heater unit here that's used to stabilize the RNA by reverse transcription, converting it to a cDNA. And that's basically a little exothermic heater that's produced through an exothermic reaction that produces heat at 48°C for a period of time to stabilize the RNA. So we've done tests in the laboratory, and we've been able to stabilize the RNA up to 28 days, which is quite a bit of time and quite a bit of flexibility for health systems to be able to hold on to things for a week and ship it once per week if they wanted to. As well as we've shown that our system is capable to detecting viral copies down to 500 copies per milliliter, which is on par with current available viral load test kits. So next directions on this project is continual development of this kit to kind of bring it to a point to be able to work for some pilot production or manufacturing partner, as well as some technology transfer in the homebrew reagents that we developed, which are lower cost than commercially available reagents.
Great. What do you see as kind of the next steps for the project? Where would you imagine starting this, testing it? Is there certain areas that would be ideal?
Yeah, we have been working in Nicaragua just because we have a very active office there. But it's also, there's a lot of need in Africa, being the highest, one of the highest area for HIV infection. So It could be in one of those countries. We haven't selected one.
What do you estimate would be the cost of the kit?
Right now, if for instance, if you're going to do viral load testing in the U.S., it costs you $150 per specimen. In Africa, that can be $300 per specimen. In Nicaragua, we saw the cost vary quite a bit based on their current methods. Anywhere from $95 to $110 cost per specimen. When you include challenges of getting the results back to the patient, and that can go up to $150 per specimen. And we don't have specific costs yet on it, but if you look at our bill of material costs that we've looked at from our parts, it does include labor and processing time. Those are approximately 50% less than doing it in a laboratory, which requires much more disposables and steps in our process.
Great. What do you see as sort of the largest challenges moving forward?
Some of the largest challenges, I would say that that's a good question. I have to think about that one.